No, this is not a queue outside a food bank, but an NHS dental clinic in Bristol last year. Many here and across the country haven't seen a dentist for years. A year since, access to dental care in 21st century Britain remains difficult for many, with poorer communities the worst hit.
You're always either in a waiting list, or there could be like 10 calls ahead of you, or you're always being seen. It could be within a few weeks.
I had very bad toothache and gum infection.
And so, what did you do?
When I went to the dentist, they told me they couldn't do it. I would have to go private.
No, I don't think I would even try, because I would just go straight to private, because if it's urgent, to wait for a month to have a nurse phone call, and then, if it's toothache, we all know it's so horrible.
According to the government figures, of the more than 35,000 dentists registered with the General Dental Council in England, a third are not contributing to NHS dentistry. There are areas in England known as dentistry deserts, where NHS dental appointments are near impossible. And so those in excruciating pain and unable to come up with the cash to go private are taking things into their own hands. With their bare hands or with pliers, desperate Britons are having to pull out their own teeth. The deep decrease in the number of dentists providing NHS care in England has left millions without access to the care they need.
So people can't access an NHS dentist because they're not making a sufficient living out of it, and they've been forced into providing private services. The majority of their work is now private because the economic structure that dentists were working in when they were in the NHS has been deliberately degraded.
Patients have also reported ODing on painkillers or drinking excessive amounts of alcohol to numb the pain. It's a crisis that's been building for decades.
Well, there's an ideological shift that occurred several decades ago. Consecutive governments decided that it was no longer the function of the state to provide health and dental services. And over the intervening years, they've gradually made it less and less attractive for dentists to work in the NHS.
A report last year said 97% of new patients were unable to access NHS care. The government says it's working with the NHS to reform the system. But for those in pain now, every single day means more agony. Saeed Pourreza, Press TV, London.